Hello everybody, happy Saturday. Got Mr. Ron Burgundy here with me. Still Ron for the time being. Still suspect Ron may not be a male after all, but we won't know for a little bit. The bugs are absolutely brutal. No shock there. So I will try to persevere as best I can. The subject that I want to cover today, and this will be a broad look at it, and this is one of those things where you could make a video for hours and hours and hours on. But everybody talks about respiratory infections in snakes, and it's a term that's used, it's a very broad term. You know, people think like, oh, my snake has a respiratory infection. Typically, most respiratory ailments that we see are secondary conditions to other issues. And also another thing that rides alongside of them a lot, now the wind's gonna screw up everything. Another thing that rides along with that a lot is mouth rot. In both those cases, almost always, those are secondary issues. There's something underlying that has caused that to happen. The bacteria and things that cause these respiratory infections or pneumonia or whatever you'd like to talk about it as in snakes are things that typically exist in their system almost always. What happens is something that we've done or something wrong with the animal has slowed their immune response to the point where those all of a sudden are no longer fought by the antibodies and by the immune system and are allowed to come to the surface. So what you have to look for is the primary cause of the infection. That could be anything from recent transport. It could be something as simple as stress. Suboptimal humidity or temperature can cause this as well. So you really need to make sure that everything's dialed in, that the enclosure is appropriate for the animal, that the animal's comfortable in that environment. Even though we outline certain enclosure types for certain species, it's not one size fits all. Every animal is going to be an individual and react in a different way to their surroundings. Stress is probably the biggest thing you want to look at when you're dealing with an infection like that, because most of the time that's going to be where it comes from. Even those suboptimal conditions, a healthy snake will often deal with suboptimal conditions for longer than you would think, but if they're stressed out about it or they're stressed out about their environment, that stuff takes hold a lot quicker. Another thing that people don't think about as commonly, I'm sorry about the bugs, is dust in the enclosure. And we're not talking about just household dust, but a lot of people use certain types of bedding, and some bedding is prone to be very dusty. And especially with your higher humidity species, they're not used to a dusty environment. So that's stuff that can get into their respiratory system, into the lungs, into the nostrils, and create issues. So you definitely, I don't use any type of aspen bedding or pine or anything like that with the species that I keep. I don't really recommend it. Now, if you live somewhere where it's crazy humid, you might be able to get away with that a little bit more, but you do want to be sure that whatever you're using is not creating dust, because that's something that really can cause you a lot of issues. Another thing that people don't think about in reptiles is vitamin deficiencies. Vitamin deficiencies can actually weaken that system and open them up to respiratory issues. And typically when we're talking about vitamin deficiencies, it's usually A or C that they're lacking that'll open them up to that point. So that's one of those things that people don't really think about a lot. But it is important to balance your animal's diet to make sure that if you're keeping a species that's going to normally feed heavily on birds and you're trying to feed it heavily on rodents, that they're getting the proper nutrition from the proper sources. It's also why you don't want to cheap out on your feeders. You want to make sure that they're getting fed a balanced diet, because that quality going into your feeder is the same quality that's going into your animal. As far as symptoms go, when you're dealing with this stuff, when what people will call their respiratory infections or pneumonia, you'll hear a clicking sound often. There can be a certain level of wheezing, open mouth breathing, where you actually observe the animal with its mouth open, and not just stretching its jaw or readjusting its jaw. Its mouth's hanging open. Oftentimes as well, you'll see the snakes with their heads sitting up in the enclosure, something that people might refer to as stargazing. Snakes with respiratory infections will often do this because they don't have the ability, they don't have a, Jesus Christ, these bugs are terrible, a diaphragm. So they can't cough and expel stuff. Like if we get something caught, we can cough and we can expel it out. They can't do that. So they'll hang their head up because gravity will pull that down and it makes it easier for them to breathe. It's not always really curing what's going on or going to necessarily help it, but it does alleviate some of the symptoms for them. And so that's why they do that, is to make breathing a little bit easier. So if you have a snake that's constantly doing that, you might want to look into what's going on there. Now also, in some cases, you can see discharge coming out of the mouth, especially after a snake's drank. And there's a difference between when it's just water coming out and when it's, a respiratory infection. It's a lot more viscous and more like a nasty saliva. And discharge from the nostrils is not something that happens normally. So you definitely want to look into what's causing that as well. Now, sometimes bedding or something can get stuck in the nostrils and they'll be breathing differently because of that, or even stuck sheds sometimes will be down in there. And so some of the sounds they make and some of the behavior will mimic a respiratory issue, but sometimes it's something that simple. So it's always good to make sure that your environment's optimum to prevent these issues from happening, to make sure you're using a bedding that's safe and not likely to do that. As much as people have this aversion to paper, with certain species, it really makes a lot of sense because it really presents no danger to the animal, or at least no more danger than anything else and less in a lot of categories. Now, a lot of people are always looking for home remedies to treat respiratory infections. And because there's so many things that actually fall under the umbrella of that phrase and so many different things that could be wrong, there's not one treatment that's going to fix everything. The major thing that you have to do is identify the underlying cause and correct that. So if it's husbandry related, if it's bedding related, if it's a vitamin deficiency, whatever it is, that issue has to be corrected, because even if you treat the symptoms, which is what's going to happen with treatment, if you're not fixing the underlying cause, then you're going to have an animal that's chronically ill or is going to be more apt to have issues again in the future. So you want to address those issues as best you can. So husbandry is definitely the place to start with almost every ailment that we deal with reptiles. I would say probably 95% of the problems or greater that we encounter are from that. Now there are other issues like cancers and growths and things like that that could also spurn on a respiratory infection as a secondary thing, or mouth rot, or whatever the case may be, because like I said, the immune system is now focused on something else or compromised. And so these bacteria and these things that are in their system can suddenly take hold. And when we talk about the bacteria that's in their system, a lot of times you get a culture back and it'll talk about gram-negative bacteria. So what is gram-negative versus gram-positive? Basically what that refers to in a nutshell is the size of the cell wall and the layers. The gram-negative bacteria has a thinner cell wall, but it's also more resistant to antibodies, and it's also, that cell wall is kind of impenetrable, and they develop a quicker resistance to treatment. So gram-negative is usually the bacteria that we're dealing with when we deal with some kind of infection like this and what we're treating. Gram-positive has a thicker cell wall, but for whatever reason, the way it's designed and the way that the layers are, it's a little bit easier to deal with things like that. So some of these gram-negative bacteria that you might hear about are like your Pseudomonas and your Aeromonas and your Proteus. There's different types. So that's why when you have snakes with these symptoms, it's ideal to get a culture done at your veterinarian and try to go to a herp vet, because your average veterinarian unfortunately has no idea what they're doing with most of this stuff. Even your herp vets, some of them are going to be fairly limited. Pretty much anybody can pull a culture as long as they have a lab to send it to. But as far as interpreting that data and knowing what to do with it and how to approach treatment, that's where you want a really good herp vet. So what's going to happen is they're going to put you on some kind of treatment right away, and in most cases they'll probably either give you Baytril or Fortaz, just because those are kind of broad spectrum antibiotics that will at least start boosting the snake's immune system while you figure out exactly what you want to attack. Sometimes those cultures can take 3 days to come back, sometimes a week. And in an advanced case, you don't want to wait on treatment, because that week could be the week, where you make the difference in saving your animal or not. Now, Baytril and Fortaz both can be very, very harsh on the snake system, especially if you don't use them appropriately. So they are not something that you want to do yourself if you don't know what you're doing. Where you inject the animals, how you inject the animals, depending on the dosage and the type of antibiotic you're using. You could do anything from cause burns on the animals. You could shut down their organ function if you don't do things properly, especially with dosages and things. Baytril is very, very harsh. on certain organs within these animals. So it's not something you want to use unless you have to. But if you're in a situation where your animal is likely to die, then obviously something that even could potentially be harmful to them is worth that risk if you know that there's no chance of saving that animal. And that's where you want that qualified herp vet that has that knowledge. There's a lot different Baytril now than when I first started as far as how they administer it and how rough it is on the animals, but it's still rough. These things are not designed for snakes. You know, Baytril is not a medication or something that was designed for their system. You can use it in here, but it has different effects on them than it would on you or I, than it would on a horse or any of these other things. A lot of the stuff that we use in the reptile hobby comes from, you know, mammal treatment, because that's where the money is and that's where the funding is, and that's what they're after making. They're after making stuff that's going to work well for mammals. So you got to keep that in mind when you're using these things on the effects, and, you know, weigh what's worth it and what's not. Some people like to nebulize, and you can nebulize certain things. There's all manner of stuff you can nebulize. A lot of people will recommend like nebulizing with F10 and things like that. Obviously, consult your vet before doing things like that. Most of what that's going to do is kind of treating the symptoms. It will alleviate some stress on the animal, which may help boost their immune system and may help them fight it off. But chances are, if you've seen symptoms, that they're already kind of past that point where they're going to really kick it on their own. You do want to make sure that they are in absolutely optimum temperature and humidity during that time. You want to keep them extra clean. Change their water constantly and clean their water dish. With a snake that I have that has a respiratory infection, I'm going to have at least 2 water dishes, and I'm going to change that water at least twice a day. And that is because, you know, all that bacteria and things that's there, they're going into their drinking water, it's there, they're drinking that water again over and over. You want them to be as clean as possible. Not to mention water just sitting, certain things are going to become more active over time. So it's best if you can keep that as clean as possible during that time, because their immune system's already down. So things that normally aren't going to bother them could really, really turn them around that corner and send them packing, which is not what you want. Let's see what we didn't touch on here. Hydration obviously is key always in snakes, but it's extra important during that time. And sometimes when the snakes are sick and not feeling well, they may not seek out water as much because they're resting more, they're a little more lethargic. So at times you may need to introduce fluids yourself. And that's another thing you can consult your veterinarian on how to do. It's not overly complicated, but you still should be under their guidance for doing that if you haven't done it before. And you want to make sure you're giving them super clean water and just keeping their system hydrated, especially with stuff like Baytril, because it's so harsh on things like the kidneys. Dehydration is harsh on the kidneys as well. So what normally, you know, if you forget to give the snake a water for a day or 2 or 3 in normal conditions that may not hurt that species, when they're being treated with that stuff that's harsh and already harsh on that stuff, it may be just enough. So everything that you're doing has to be extra. Also, while you're caring for a sick animal, if you can get it away from the rest of your collection, that is obviously ideal. Respiratory infections and the things that cause them can be spread from animal to animal, and if one animal's in suboptimum conditions, there's a chance that your others may be as well, and you're just not aware of it. So, you know, especially if you have, say, mites in your collection, you know, mites can, you know, bring on anemia in snakes, and then as well, obviously being parasitic, it stresses the animal out. And so now it's much easier for them to get a respiratory infection, and then it's feeding on this snake and going to another snake in your collection. So mites are obviously something you want to avoid always, but even more so when you have an animal that's ill. So we talked about that it's a broad term. We talked about the bacteria. I don't know if I mentioned it, but it's not always bacteria that causes these infections. It could be viral, it could be fungal as well. That's where the culture comes in handy. The culture is going to identify exactly, or at least narrow down what you're fighting. And that's where you'll find out, oh, you have this gram-negative bacteria and it's a, you know, a Pseudomonas, and then the vet might say this is the appropriate antibiotic for that type of thing, and you might switch to something else. So that's where that really helps you attack it, because if you're not attacking with the right thing, it's not optimal, and prolonged dosages of medication become less effective. And if your animal gets an infection again in the future, it may reduce the effectiveness of that medication because now that animal's been exposed to it. You know, just like people have a tolerance for alcohol or any other substance, the more you put something into your body, the more your body adjusts to it. And so it works that way with certain antibiotics as well. So you only want to use them if you have to, and use them appropriately. Also, Naitovirus, that's a whole nother subject, but Naitovirus presents a lot like a respiratory infection. It's just one that's you can't really get rid of. And Naito, from what we understand, kind of sits a lot like this other stuff does, and it can sit in the snake system. And they say if you have a larger collection, like over 20 some odd animals, that there's a pretty good chance that Naito's already in your collection. And so what happens is all of a sudden you lose power, or you go on a trip and your humidity goes off, or whatever it is, and all of a sudden now that's able to take a foothold and start affecting the health of that animal. And there is no cure for Naito at this time as far as I'm aware. And so, it's pretty much a death sentence to your animal. It's just a question of when. Sometimes it can live with it for a very long time, but it is contagious and does spread. So if you have an animal that's symptomatic of any kind of respiratory infection, you always want to, as I said, move it away from your collection if you can. You want to use gloves if you can. Use different equipment with that animal. Basically, don't use anything from feeding tongs. Don't have your phone out when you're dealing with that animal. Don't touch your phone after you're dealing with that animal. You have to be as sterile as possible with that, and more importantly with your other animals, so you don't transfer anything to them. Jesus. So we mentioned the vitamin A and C deficiencies, and basically vitamin A and C are kind of key to the integrity of mucous membranes. And so when there's less of those, vitamins in their system and they're deficient in them, that's where that issue comes. And with snakes, actually, I don't know how often, I haven't seen statistics on it, but one of the reasons that they die from these respiratory ailments, as I mentioned, they don't have a diaphragm, they can't cough, they actually get plugs of mucus stuck down, down inside their glottis, inside their tract to their lungs, and they can't breathe, and so they actually die from that. So it's not even like the bacteria itself is getting them or whatever else. Sometimes it's just as simple as that gets plugged up, they can't expel it, and they die. Now there are ways to expel that stuff yourself, but typically that involves anesthetizing the animal and using gravity or certain flushes to get that stuff out. Once again, that's something you're going to have to do through a vet. Obviously, the best way to treat an RI is to prevent it. And the best way to prevent things is with proper husbandry, good care, good diet, being observant, keeping our eye on our animals, any behavior that's outside of their normal, questioning it, asking why it's happening, what could be the cause of it, is there something going on that you need to be paying attention to. And obviously, as a new keeper, you're probably going to raise your alarm more often than an experienced one. And sometimes that can work to your benefit, because maybe an experienced one sees a behavior that for this animal is indicative of it being sick, but maybe it's fairly common in other animals they keep, and so they overlook it. What are you doing? I guess he's gonna wrap around my arm. Yeah, so you definitely want to stay on top of this stuff. It's definitely something to look into, to research. There's a lot of great papers out there. There's a lot of stuff written by very, very knowledgeable people that you can read and learn. Definitely good to learn the medical terms involved with this stuff, to understand, when you understand the causes, when you understand the symptoms, when you understand how all this stuff works together, it's a lot easier to devise a treatment or to figure out the best course of action for you to take. So don't necessarily dismiss vets as some people will, but also don't dismiss the fact that a vet can't fix your husbandry and can't fix necessarily what's causing the issue in all cases. If it's not caused by a medical thing, it's caused by your care, the vet can't fix that for you. You have to fix that yourself. So definitely be aware of that, because that's like steps 1, 2, and 3 to healthy snakes, is how you care for them. Keeping them clean, especially with these guys, is important. These guys are heavy breathers with their lungs. So these guys are very, very prone to respiratory infections and prone to dying from them. They don't recover as well as a lot of other species. Burmese pythons are another one that doesn't recover well from respiratory infections. These primitive lungs that snakes have aren't really designed to fight that kind of stuff. And it's not something that's commonly going to occur in their native environment, because their environment is optimal for them. Their husbandry is pretty much always optimal. Plus, baby snakes in general, for whatever reason, whether it's better immune function or whatever it is, maybe because their lungs are smaller, easier to keep that stuff clear, don't seem to be as prone to these issues as adults. So that's why sometimes as babies, you know, kind of like we talk about our children when you're building up their immune system, let them play in the dirt, that kind of thing. Sometimes that stuff can help build the immune function later on in life with these snakes. So while I'm not suggesting that you don't keep things sterile and keep things clean, you know, people worry about taking their snakes outside. If it's a safe environment, getting them exposed as babies to some different things necessarily is not going to always be a bad thing for them. You want to do it in a controlled fashion and be safe about it. I'm not saying I'll let that snake sit in its own feces for a week. But there's a lot of keepers of a lot of species that when they clean a cage or they change bedding, they'll leave a small amount of the old bedding in there, a small amount of something that helps towards building up that immune system for the animals later in life. So that's something that you could look into and consider as long as you do it appropriately. It's something that many keepers have done of much more difficult species to keep, and it seems to have paid off in dividends for some of them. I don't suggest doing it without getting the knowledge first on how they're doing it and why, but it is something that you can definitely look into. So we will see you guys on Tuesday with a tip video. Once again, no idea what I'll be doing, but I'll figure that out. We will see you later.